Do your legs feel heavy by the end of the day? Maybe little swollen around the ankles by the evening? You probably thought it is just tiredness. I'll sleep it off. But what I'm about to show you, what actually is happening inside your veins right now, and why dismissing it could cost you far more than one bad night's sleeps. Your veins have one job, that is to carry blood back up to your heart against the gravity all day, every day. And to do that, they have tiny one-way valves inside like little trapdoors. Blood flows up, valve closes, blood stays up. That's a design. But when those valves start weakening, those trapdoors stop closing properly, blood falls back down. It pulls in your leg, and that is when trouble begins. In my 30 years as a vascular surgeon, I have seen this story play out hundreds of times. And every single time, the patient says the same thing. Doctor, I wish I had come sooner. So, let me be very specific. What are the early signs when your veins start struggling? Sign number 1. Your legs feel heavy and dragging by the afternoon. Not I walked a lot, tired. I mean that deep bone heavy feeling that makes you just want to sit down. That's called venous pooling. Sign number 2. Ankle swelling by evening. If your socks are leaving deep marks on your skin, that is not normal. That is fluid your body cannot drain properly. Sign number 3. You are seeing blue, purple, twisted rope-like veins around under your skin. Most people think it is just cosmetic. No, it is not. It is a symptom. Leg cramps at night, waking you up from sleep, especially in the calf areas. Many people blame the mattresses. It's actually the veins. Sign number 5. Itching, darkening, or a dry scaly skin around the ankles. In our field, we call that skin at risk. It's a serious red flag. If you have even 2 of these 5 signs, please do not ignore them. Now, here is what surprises most people when I tell them. I am not describing a 70-year-old patient. I am talking about very young, 26-year-old software engineer who sits for 10 hours a day, a 32-year-old teacher who stands all day in a classroom, a young mother of 3 months after delivery. Poor vein health does not care how old you are, it cares about your lifestyle. And here is why this matters beyond the discomfort. When blood pools in the veins for months, sometimes for years, it can form clots, deep vein thrombosis or DVT. A clot in your leg can break free, can travel up to your lungs and can cause pulmonary embolism, which can become fatal in few patients. I am not saying this to frighten you. I am saying it so that those tired, heavy legs stop feeling like a small problem. I had a patient who was a 44-year-old school teacher from Vadodara. She had leg swelling for almost 3 years. Most doctors told her that it was a stress, fatigue, lifestyle, age, etc. etc. When she finally came to me, she had grade 3 chronic venous insufficiency. We treated her, but the skin around her ankle had already started breaking down. They were almost like ulcers. She was weeks away from a venous ulcer, from a wound that doesn't heal, or it takes very long time to heal. 3 years of it's fine when it was not really fine. These kind of cases stay with me because it was completely preventable. So what do you actually do? 1. Every evening, elevate your legs, lie down, put your both legs up against a wall or on a pillow for 15 minutes. It's free, it works, it drains that pooled blood. 2. If you sit or stand for long hours at work, wear medical grade compression stockings, not those fashion stockings. Medical grade compression. They apply the right pressure like 23 mm of mercury at the right places. 3. Walk. Even 20 minutes a day, your calf muscles, they are a pump. They act like a pump. Every step pushes blood back upwards. Use your pump, use your calf, use them. 4. And that is very important. If you ever see the warning signs I have described, see a vascular specialist. A venous Doppler ultrasound takes only 30 minutes, but it tells exactly what's happening inside your veins. No guesswork. If you find this useful, share it with one person in your life who has been complaining about tired legs or a swollen feet. Most of us sit with these symptoms for years, not really realizing what they mean. Drop your questions in the comments. I personally will read and answer them all. Poor vein health is not just about how your legs look, it's about your ability to walk without pain, to stand through a full work day, to sleep without cramps waking you up at midnight. The good news is, if you catch them early, it is very much manageable. You do not always need surgery, but you do need to act on those things. I am Dr. Vijay Thakore, a senior vascular and endovascular surgeon. Your veins work very hard for you every single day. Take care of them. See you in the next video.